The upper eyelids, usually there's a little redundancy of skin and muscle, so I end up removing that, and then I evaluate, is there a little fat pocket, and possibly remove some of that. So as I'm talking to somebody, we're looking in the mirror, we're going through what they see, we're going through what I see, making sure that they don't actually have a droopiness to their eyelid that would require an ophthalmologist to repair the muscles. That's sort of a different conversation called ptosis. But for the eyelid surgery that I do, once we figure out what is the patient's concern, then we come up with the plan. Sometimes this can be done with local anesthetic or numbing medicine only in the office for the uppers. And sometimes it's a bit more work, or someone's just not up for having a procedure with numbing medicine in the office. And so in those situations, we would go to the operating room. It's a fairly straightforward, relatively short, about an hour and a half for the uppers, and under general anesthesia if circumstances were such that it needed to go to the OR. Typically after surgery for the uppers and eventually for the lowers, you go home the same day. You have tapes on your eyelids for a week. There are some stitches that come out, and that's at a week's time, and the tapes come off, and then most people can go back to work and feel pretty presentable at a conversational distance at a week's time. And then for the lower eyelids, it's much the same as far as the evaluation, seeing what's going on with the patient, making sure that what their concerns are or what the procedure can offer. And then also checking to check eyelid tightness, things like that, because sometimes there's some supportive stitches or things that need to be placed. And we go through all of that to make sure their eyelid position is pretty or handsome afterwards. And once I get through the planning process with them, then we similarly would go back to the operating room. I do not do lower eyelid surgery under local anesthetic in the office. When you inject it, it sort of fills up the skin. It sort of raises a wheel of fluid under the skin. And when you're trying to really look at the contour of the fat pockets and make sure that transition between the eyelid and the cheek is nice and smooth, I find that if I put a whole bunch of numbing medicine in at the beginning, it makes it more difficult to tell that contour is just right. You can do eyelid surgery a second time. It's interesting how long it tends to last. We often see people feeling really good with their results, easily 15 years down the line, but oftentimes I'll have patients that are like, yeah, I'm 65, I'm looking at a facelift. I had my eyelids done in my 40s, and I still love them, and they do look good, So it definitely has a lasting effect. But there are times when the skin eventually develops enough laxity again or what have you that another little refreshener is beneficial and it can be done.